Mr. Speaker, I wish to turn our attention to the issue of mental health and that of suicide in Northern Ireland. I speak on the issue as someone, like I'm sure many in this House, that have been affected and seen firsthand the impact of suicide on a local community. I was 15 years of age and a pupil at Craigavon Senior High School when I first encountered the word suicide. 3 young men from my school year, all with lives to live for, sadly took their own lives within 1 month. To this day, I think of their families and the pain that they incurred at the time. 14 years on, and it was with great sadness that I read the most recent statistics released by Samaritans on the suicide rates across the United Kingdom. To our shame, collective shame, Northern Ireland vastly exceeded the rest of the United Kingdom. For every 100,000 men in Northern Ireland, 28 will die of suicide, compared to that of 15 men in England. Despite the disturbing suicide rate in this country, that continues to grow year on year. Northern Ireland spends less than half per capita in supporting people suffering with mental health than that which is spent in England. I want to commit in this House today to help fight the destructive plight of suicide, which has caused unimaginable suffering across this province. This is a vice that can be broken, Mr. Speaker, but we need to act now. I welcome the seriousness in which this House, and indeed the Executive, has taken in relation to the issue of mental health and its sad consequences. Though in reality, much more can be done. And I implore the Minister to continue his approach of additional budgetary allocations across departmental towards facilitating care and attention required to changing lives. This is an issue that transcends party politics. It cannot be good enough, whether you're from a unionist persuasion, a nationalist persuasion or other, that people, citizens among us, feel that the only route left to them is suicide.